Everyone, my name is Jingyu Li. Today I will talk about hiatal hernia. What is a hiatal hernia? A hiatal hernia is a condition that causes part of your stomach to bulge through the hiatus in your diaphragm. The part of stomach may move up or down, or it may get trapped above the diaphragm. So what is the esophagus? A muscular tube that connects thorax to stomach. Passes through the esophageal hiatus in diaphragm, just stomach at cardiac orifice where cardiac sphincter closes off lumen. The diaphragm helps you breathe, and it helps prevent us from coming up into your esophagus, which is the tube that connects your mouth to your stomach. Normally your stomach sits below your diaphragm. You can see here. If you have had a hernia, your stomach pushes through a small opening in your diaphragm. And the esophageal hiatus is oval-shaped opening located at the level of 10 to 11 thoracic vertebrae. It is controlled by certain ligaments, you can see, and membranes. They normally work by sealing all potential spaces between the esophageal hiatus and the esophagus. Actually, hiatus hernia are very common in the daily life. Up to half of the population may have one. But it occurs more frequently in elder people. Clinical estimation report that approximately 50 to 60% of patients who are over 50 years old suffer from hiatal hernia. There are many factors influence the development of hiatal hernia due to the increasing prevalence in elder people we have talked about before. It is believed that muscle weakness and loss of flexibility which age predispose to the development of hiatal hernia, along with decrease in elasticity. The cardiac may not return to its natural position below the diaphragm in normal swelling. Another important factor predisposing to the development of hernias is the increasing in intra-abdominal pressure, obesity, and pregnancy as an increasingly common pathology is associated with an increase in pressure in the abdominal cavity. There are several different types of hiatal hernias. Two are the most common: sliding and the presophageal. Sliding hiatal hernia is the more common type of hiatal hernia. With a sliding hiatal hernia, the stomach and the part of esophagus and that connects to the stomach slide up into the chest through the small hiatus opening in the diaphragm. With paraphageal hiatal hernia, the stomach and the esophagus stay in position. You can see, but a part of stomach squeezes through the hiatus and pushes against the esophagus. When this happens, there is a risk of the blood supply to the stomach being reduced or shut off. For most of people with hiatal hernia, they don't have any symptoms. While others may show symptoms with closely resemble that of GRED, such as heartburn, abdominal pain, bloating, and you can see there are some other symptoms. So, how is a hiatal hernia diagnosed? Such as chest X-ray, endoscopy, brain spallal test, and pH test. The use of endoscopy has become common over the past few decades and is now considered a standard method of diagnosing and treating upper GI diseases. The most commonly accepted diagnostic criterion for endoscopy hiatal hernia is a proximal displacement of gastroesophageal junction over 2 centimeters above the diaphragmatic cavity. CT or MR scan may provide a 3D reconstruction of the anatomy. You can see here and here. So then how is a hiatal hernia treated? There are two different ways. First is the medicine. Your hiatal hernia but actually your hiatal hernia may not need treatment if it does not cause signs or symptoms such as recurring heartburn or acid reflux. If you use the medicines, your doctor may recommend and ask to neutralize the acid medicine to reduce the production of acid, or medicine that blocks the production of stomach acid and heal the esophagus. But for the surgery, I want to talk about a current research. About how to treatment of hiatal hernias. The people who have symptoms, the patients who have symptoms require operative repair with an anti-reflux producer. Key operative steps include the following: reduction and excision of hernia sac, 3 centimeters of intra-abdominal esophageal lines, closer with match reinforcement and anti-reflux producer. Repairs not to key steps may undergo gastropexy and gastrotomy placement as an alternative producer. So actually the surgery may involve pulling your stomach down into your abdomen and reducing the size of the opening in the diaphragm. Okay, so that's all of my presentation. Thank you, and this is my reference.